Hi guys, so we're going to talk about research, and I do know that many of you may not be excited about this chapter, but it's going to be short and sweet, so that's a good thing. I think and hope that you'll enjoy constructing experiments with your groups, um, and I think you will learn some important things. So let's go. Oh, that's not good. Hang on a sec. The first is why are we talking about research? Why do psychologists think about research? What kinds of research do we do within the area of psychopathology or clinical psychology? And the answer to that is that we do lots of epidemiological research, and that is research that helps us understand how often mental illness occurs, so population epidemiology, who is particularly at risk, so what groups of people, what kinds of people tend to get certain disorders over others, um, and also whether there seems to be genetic risk of any kind. And so kind of the description, essentially, and understanding trends in mental illness. We also do a lot of treatment outcome research to see what treatments are most effective in general, what treatments are most effective for particular disorders, and what factors. So, for example, we might have what characteristics of a therapist it might indicate, or what behavior in a therapist might lead to better outcomes, what treatment approaches might lead to better outcomes, etc. And then we also have something called meta-analysis, which we'll talk about at the end of today's lectures. And meta-analysis is a way of using existing research and kind of bringing together a body of research to answer important questions. So let's talk first about epidemiology. And so the two big words here, epidemiology and prevalence rates, in terms of this particular topic. And prevalence rates really, right, if you know the word, like how prevalent is something, or how likely is something to happen, how common is something, or another ways of thinking about that. And prevalence rates we will talk about with almost all the disorders. I think probably all the disorders that we talk about. We will talk about what the prevalence rates are, and we may sometimes talk about the fact that prevalence rates for some disorders are higher for men or for women, or higher in some cultures than other cultures. And all of that is about how likely is it, how many people, what percentage of people of a certain group or of a certain population are likely to be diagnosed with this. And so we often see lifetime prevalence rates. We also may see current prevalence or incidence rates, like at this point in time, how likely was this disorder to be happening. Prevalence rates tend to be broader, incidence rates tend to be more focused. For example, following the COVID pandemic, we might be really interested to know what happened, what were the incidence rates of anxiety disorders, or people presenting with anxiety symptoms following or during the COVID pandemic. And we might find, I suspect, that those were higher than our baseline prevalence rates of what we normally expect to be happening at any given time. And this research is often done just by gathering a random sample of subjects and surveying them, either asking about current symptoms or asking about lifetime symptoms. It also might be done, and I can imagine this for COVID, for example, by surveying family doctors, general practitioners over the next 6 months to see whether whether complaints of anxiety symptoms have increased among their patients. And so we can do that in a number of ways. So one sec, I just want to pull up something else here. Oh, not that. This. And so this is a chart showing lifetime prevalence rates for DSM. It's a little bit old, so it's DSM-4 disorders. It's before the 5. But you can see it's this first column we're interested in, which is the total lifetime prevalence rates. These columns that go by age are showing at a specific age how likely is it that people in that age group have developed one of these disorders. And so you can see the total for panic disorder is 4.7% of the population will sometime in their life be diagnosed with panic disorder. And you can see all of the anxiety disorders, and the next group down is the mood disorder. So we see that about 20% of people have at some point in their life met criteria or will meet criteria for a mood disorder. Most of those are major depression, which is much more prevalent than the other disorders that we'll talk about. And then if we go down to the next group, it's disorders first diagnosed in childhood typically, and you can see the numbers there. And so, if we go down to any disorder, which so down at the second to last here, so any disorder, and I think you can see the highlighting that I do there, 46.4% of people will meet criteria for some psychological disorder during their lifetime. And that, I think, is a really significant number to look at, and it's why epidemiological research is so important. We know that almost half of people will meet criteria for some disorder at some point in their life. That really changes the conversation, and if you think about how that might inform our conversation about stigma or other things, it becomes a really important conversation. So, okay. All right, so epidemiological research might also be interested in prevalence rates among certain groups, as I said a little bit ago. So the most common example I can think of is men and women. We'll talk a lot about differing prevalence rates for men and women for different disorders, but we might also be interested in different cultural or ethnic groups. We might be interested in people who live in urban versus rural areas, and so we can talk about the epidemiological research that happens in kind of pieces of the population as well as the whole population. So the other main area of research that psychologists get really interested in is the idea of risk factors, and the idea of what characteristics of a person are likely to be present either before or during the experience of a psychological disorder, or even after the experience of a psychological disorder. And this is based in correlational research. Hopefully you remember everything your Intro to Psych professor wanted you to learn about correlational research, but hopefully, if nothing else, you remember that correlational research does not establish causation. And so this is not research looking to see what causes mental illness, because we often can't do the experiments we would need to do that. It would be unethical, right, to try to cause a mental illness in a person. And so we settle for correlational research. And so essentially here, the researchers are going to look at variables, characteristics that seem to have some relationship with mental illness, so that characteristics that show up more often in people who have a psychological disorder, or perhaps characteristics that show up less often in people that have a psychological disorder. And of course, it's not going to be true for every individual with a disorder, but we're looking at group trends here, right? So we're looking at, if we look at averages for childhood loss of a parent, right? Is it more likely that people who are depressed in adulthood experience the loss of a parent than people who are not depressed in adulthood? So that's the kind of thing we're looking at. We don't know, again, if that other factor caused it. We just know that it has a relationship with it of some kind. And so if we look here, this is the Mayo Clinic website, and these are the risk factors for depression. Right, and so we can see that certain personality traits, including low self-esteem or being too self-critical, occur at higher rates in people who experience depression. People who experience depression have a higher likelihood of having had in the past a traumatic event or abuse of some kind, or traumatic loss of some kind. And, so people who are lesbian, gay, bisexual, or transgender have higher rates of depression, and so that's correlated with depression. And again, it doesn't mean that everybody who has that trait or that characteristic is going to become depressed. It's that it occurs in higher rates, that depression occurs in higher rates among some groups than other groups, right? And so that is correlational research in terms of the risk factor is if you fall into one of those groups, then what somebody could predict is that you have a higher risk for depression than somebody else. So if we go back to our slides, let's do this. Right, and so this is the website that we were just looking at, and this is what we were just saying. So I'm going to move on from here. Obviously, when we have our live discussion, whatever questions you have about that, you can ask, but the important thing to remember is that correlation is not causation, and that we do this correlational kind of research and talk about risks when we're in a situation where we couldn't do the experiments we might otherwise do to see what could cause it. One of the kinds of correlational research that we do is about genetic risk, and we're going to pick up with the next video talking about that.